Well, in January of this year, Washington State reported one of the first cases of COVID-19 in the U.S. And since that time, the city of Seattle has really been on the forefront of the pandemic response. And I'm joined now by Chief Harold Scoggins of the Seattle Fire Department, who can tell us about the lessons they've learned. Thank you for being with us.
Hello, Cara. Thank you for having me.
So what do you think, looking back now, one of the most important things that you have done was to protect everyone from COVID?
Well, that's a pretty big question. There's been a lot of things that we've done over the past 8 to 12 weeks. Like you mentioned earlier, we in the Seattle Fire Department, we've been paying attention to this since the 3rd or 4th week of January when that first case landed. And then late February is when we really went into full swing with deploying our pandemic infectious disease plan. And that was really significant for us as an organization as we move forward and trying to understand what we were dealing with. That was really important for us, but formed a lot of partnerships along the way with other local governments, our county, our state government, our private partnerships. I mean, all these things have been really important for us. Even you've heard a lot of conversations around the country about PPE and different things like that. Well, we've had those same challenges here, but I think we're fortunate to have really good partners in the region like Anchor Innovations or Gates Venture Foundations, or even our local Seattle 4 Rotary Club, who have all made significant PPE donations to help us through this. We've changed a lot of policies, practices in the organization. You've all seen the social distancing, the stay-at-home orders.
Yeah.
Our city has put in so many things to help community.
Chief, we're talking about trying to flatten the curve here as well, and we certainly have those who think we should do more social distancing and others who are pushing to reopen our economy right now. What's your advice for decision makers here, given they're a little farther ahead than we are?
Well, our advice is to listen to people who understand the science, who understand what's actually happening with the spread of the disease. I mean, we're fortunate to have excellent doctors here in the region, excellent epidemiologists who are really doing a lot of the modeling and helping us through this. And that's what we're doing. We're listening to the people who are, this is what they do. I've been a firefighter for 30 years. So when my mayor, who's been leading during this crisis, asked me about fire, she listens to me. Well, we're in a pandemic right now. We listen to the scientists, the doctors, and the epidemiologists, and I think that's really helped us a great deal.
I know you've had a lot of your first responders affected by COVID-19. What are you doing specifically now to protect them?
Well, absolutely. We have been changing our policies and practices for the last 8 weeks. Every week we have been issuing a new training package for the entire department based on what we learned over the last week. Everything for how we're responding into homes, the amount of people that are responding into homes, our dispatch protocols on the questions that we're asking, and if a firefighter does get impacted by COVID-19, we have a place for them so they don't have to take that home to their family where they can be quarantined or isolated. One of the other biggest things that we've done is we set up our first responder testing site. The state of Washington Department of Health gave our department permission to actually do our own COVID-19 swabbing of our first responders, so we can now know right now if we're impacted. That was really big for us.
That's something that I know our scientists have said is very important, ramping up the testing. In our closing, what advice would you give to the leaders here in Connecticut and maybe others across the country, given that hindsight sometimes is 20/20?
Well, that's what we're trying to do. We're trying to learn from those who were in front of us and understanding that every community is different, and understanding that most communities, if not every community, has access to doctors and epidemiologists who understand that region a little bit more. So reach out to the professionals, reach out to other communities that have already gone through it, that are ahead of you, that are going through it with you. And also reach out to those communities who may be a little bit behind you so you can help them through it. But there's a lot of information out there. We know that all the answers aren't out there, but ask the tough questions and you have to make the tough calls.
Thank you, Chief, for sharing your advice with us, and we wish you all luck and good health in Seattle.
Wishing you the same.
Thank you.